Hello, everybody. Welcome to the It Hurts to Mom podcast. I'm Lauren Rose, and today's guest is Kristen O'Dell. She's a board-certified family nurse practitioner with almost 20 years of experience working with newborns and their families in the NICU and well baby nursery. She seeks to reduce postpartum mental illness by better preparing pregnant women for their new role as a mother, identifying and talking to birth parents, and forming a postpartum mental wellness plan while her clients are still pregnant. Having suffered from PPD and antepartum PTSD, she has a unique perspective as a provider who is trained in Western medicine at Columbia University, but also practices with a more holistic approach, which is my favorite kind of doctor. or nurse or medical professional. Yes.
Yeah, well, yeah. Thank you, Lauren. Thank you for having me on your podcast. And thank you for that warm welcome and that introduction. That was beautiful hearing that the way you put it. And it's all absolutely true. So, yes, I do. I seek to reduce postpartum mental illness. And I think it's best done with more preparation for moms.
Mhm.
I mean, basically, we take prep courses and classes for everything, especially now. There's access with computers, and we take a planning course to learn how to drive. We take an SAT prep course. We take courses in college to prepare us for certain jobs. I mean, there are courses and classes out there for everything. And there are some for preparing for your birth. So there's labor and delivery classes, there's breastfeeding classes. Sometimes there's parenting classes, they're hard to find, but there's really no class to teach us how to become a mother. There's such a transitional role change in becoming a mom, and there's so much information that we have to learn on the fly, as well as manage our hormones, our postpartum bodies, whether or not we're breastfeeding or bottle feeding, what that looks like to us, the stress of that, stopping breastfeeding. There's just so much rolled up into becoming a mother, and there's just really no course, like prep course, to prepare us for all of that. And so that is what I feel we are lacking as moms, that would just really help get us off on a better start. And so that's what I have designed, is something to help moms come into motherhood with more confidence and less mom guilt and uncertainty.
I love that. I took, the little classes at the local hospital for, basic, baby care and, C-section stuff because I had to have a C-section. And I still didn't get enough information.
Very true. I always do suggest my clients take their local hospital classes, because sometimes they'll learn particular things in there that might be for their physician that wants them to know, or some different protocol that their hospital may follow. For example, some hospitals allow VBACs, which is a vaginal birth after a C-section, and some hospitals don't. And so it is always a great idea to call your labor and delivery unit and see what classes they offer and to take those. And while there is value in them, I definitely agree with you that I think many of them are lacking a large portion of what new moms and even repeat moms might need to learn about themselves, and for sure their postpartum bodies. I mean, it's amazing how little we are told about what it's like for us after the baby is born, whether vaginally or C-section wise, what it's like what it feels like, for us, how we should take care of ourselves, as well as at the same time we're taking care of and feeding an infant. It's a lot. Also, on the same side is that our partners, whoever your partner may be, they're not always taught very much how to support us. And many of them
Mhm.
really want to. They want to do better in helping us transition into that role. They're also transitioning into their own roles as the other parent, whether that be a father or another mother. And so it's a lot for them too. And so there is, conversations that should be had with couples before the baby's born. And that is part of my course as well, talking about certain things, talking about how they can help support you when you're going through a painful time, whether that's physically or mentally, how they can help you with feeding the baby when you're breastfeeding. A lot of people don't know what that looks like, because if a mom's breastfeeding, how can the partner help? Because if they're not breastfeeding and you are, what can they do to help? There are things that they can do to help, and that's not always taught. And as new moms, sometimes we're just so overwhelmed, we aren't able to communicate that well to our partners on how best that they can help us. And so I do think a lot of these communications should happen before the baby's ever born, over dinner, over a couple of date nights before that baby comes in. And I usually give my clients a whole list of great topics and conversations to have beforehand so that they can strengthen that relationship, come up with some really great. I actually use code words in my class. So if a mom's suffering from some postpartum depression, many times it's the partner that realizes it before the mom even realizes it.
Mhm.
And the partner doesn't quite know how to express this to the mother because they don't want to upset the mother. They don't want them to feel like they think they're not doing a good job, that they're a bad mom. And so they don't say anything at all. And quite honestly, they really should. And so in order to make that easier, to make that conversation easier, there's a conversation we have beforehand, as in, the mother will communicate how she would like her partner to tell her that information, that they're maybe concerned or they think she could use a little help. And there's code words that we can put in. So they don't even have to have that conversation. It could just be a code word. And it makes it a little easier. Instead of hearing from your partner, I think you're depressed, it could be, you're hearing from your partner, the word 10 Oreos or something that comes up like a really comforting food or something like that can be used as a code word to just really let your partner say, hey, I'm worried about you and I love you and I just want to make sure you're okay. And without saying those really hard words, we have other methods and other ways of communication to try to help out mom. So yes, these courses are great, and many of the courses that you'll get at your hospital are birthing courses. It's like Lamaze, breathing courses, things like that, and they're wonderful. But we have to remember, as pregnant women and as new moms, that these courses really are only for a very small portion of time of our motherhood journey, right? So labor and delivery usually lasts, anywhere from hours to a couple of days. And then that experience is over. You've now transitioned into motherhood. But that whole course that you spend hours and hours on, it might not have even applied to you. It might have been a Lamaze breathing class and you ended up with a C-section, right? So like they're valuable to a point, but we put so much like, oh, well, we're gonna be ready for this motherhood journey by taking this course over here and we're good to go. And quite honestly, it's really a small drop in the bucket of time that we're spending in that motherhood role, that course right there prepared us for this tiny piece of it. And sometimes it might not even apply. So while it's great to do in case you need it, it may be helpful for you. We have to make sure we don't have that misconception that, hey, we've got it all in the bag now. We know everything we need to know about this new role coming up in our lives. So just keep that in mind. Yeah.
Absolutely. That makes so much sense. So let's talk about birth trauma for a few questions. Can you explain what birth trauma is and how would a mom know if she's experiencing it?
Sure. So birth trauma can be a lot of different things for each person, but typically it's when a mom goes through her birth and it doesn't come out as expected for many reasons. Maybe her pain wasn't managed properly. Maybe she had a C-section when she really wanted a vaginal delivery. Maybe her baby ended up sick or ended up in the NICU, and that's not anything really anybody prepares for. And so these experiences can cause stress around the birth time, either while she's in labor or even afterwards. And it has this feeling of being let down, or that you let yourself down, and it ends up into feeling of trauma. So you end up remembering your birth in a negative aspect or a negative light rather than a positive, beautiful experience that brought, this new little one into your life. Birth trauma can stay with us for a really, really long time. And it can compound over time. So in a second time that you're pregnant, you relive all that birth trauma throughout your second pregnancy as you stress out about the first experience you had and worrying that it's going to be that way again or worse. And we tend to really focus on the negatives, really even looking up and Googling all the terrible things that can happen when it's probably pretty low chances that would happen again. Typically, 90% of births usually don't even require a neonatologist to attend your birth. While all the births I attend require me, that's really only about 10% of the births that happen in my hospital. The other 90% don't even call a NICU nurse practitioner to it because everything is going great. And so the tough thing about birth trauma is it just stays with a woman. It really impacts her feeling about her next pregnancy. And instead of remembering our baby's coming into this world with joy, it gives us feelings of stress and anxiety. And some women can have PTSD. It can go so far as causing post-traumatic stress disorder after having a particular birth, a traumatic birth. And some women may require, professional help after that. It can also increase your risks for postpartum depression and anxiety afterwards as well. So it's a really important thing to, pay attention to. A lot of women suffer from birth trauma, but don't even realize that there's a name for it. And they just have this really negative feeling and negative experience around their labor and delivery and their birth of their baby. And they don't quite even understand why they feel that way.
Okay. Is there anything that pregnant women can do to guard against birth trauma?
So a big thing is mindset. First of all, having certain conceptions in our minds about what our birth is going to be like. Many women consider themselves type A or high functioning, and they have like everything in their lives is under their control the way that they want it. And it's really important for women who are like that or have that personality style to really understand very early on that there isn't that much that we control in our labor and delivery. There are things that we can control, and there are things that we can maybe have choices in. But in the end, that baby also has their own agenda, and sometimes it doesn't match with ours. And we have to make sure that sometimes we go against a plan or an idea of how it goes in order to keep everybody safe. And so I really think a big part of reducing birth trauma is recognizing that very early on that and that's why for my clients, I work with something called a birth preference plan. We don't call it a birth plan. We call it a birth preference plan. And that's because birth plans never go to plan. They never do. It's almost as if you ever heard of manifesting before? Some of you might have
Yeah.
heard of manifesting. You put it out into the world and that's going to happen. Well, we put these birth plans out into the world and we're very rigid with it. It's almost by like writing it down. It's like the opposite of manifesting. We get like the opposite of it. And I think it's really better off on the birth preferences to say, well, if I have a choice in this, this is what I prefer, knowing that you may be given a choice or you may not for something depending on safety of you and safety of your baby. But you do have control in some aspects. So I think it's really important to reduce birth trauma to grasp onto the things you really can have control about. And that probably is your pain management. So having a conversation with your OB about your pain tolerance, what the pain control options are. Some hospitals can use nitric oxide, some use epidural, some use Stadol, which is a medication. Some use none, and they use breathing techniques, and aromatherapy is an actual studied modality that has been approved for pain relief in labor. Lavender is something you can diffuse that helps calm you. And when you're more calm, it's easier to control your pain with your contractions. So there are a lot of different ways to control pain. I think pain is a really big one when it comes to birth trauma. If you can introduce ways to control your pain, you can really reduce some of your birth trauma. And then it's, of course, having great relationships with your providers. So having an OB or a midwife that you really know, like, and trust, and you have a great relationship with them, that's really important, because when you're in that labor and delivery and something isn't going to the way that you were hoping it was going to go, you have a provider that's willing to sit with you, talk with you about it, explain it out to you, rather than just tell you what you're going to do. And so having somebody that you get that feeling from, that's going to work with you and explain with you and just take time with you, really says a lot about reducing our stress in that moment and allowing that person to help guide us through that, transition of birth in a trusting way. And also that, going over that birth preference plan with them so that they know what your preferences are. For example, do you want them to tell you every little thing that they're doing down there, or would you rather them just do what they need to do and not say anything? There are people who are one way or the other, and it may make a big difference for you and your birth trauma and your birth experience. If you want them to tell you every little thing and they're not, that can be really stress producing for you. So you want to have providers that will listen to you, that will respect your preferences when they can, and then also have them very easily written out and communicated to them so that you can have the experience that you want. So I definitely think, we just have to recognize we can't control everything, but then learn what we can advocate for ourselves and how to do that. And then find providers that are willing to, spend extra time with us. The world of medicine today is everything. No one has enough time for their patients. Everyone is too busy computer charting, and the hospitals are really, really chock full and not enough staff. So it is hard, but you really sometimes might need to make a couple of provider appointments, OB appointments, midwife appointments to try to find the right group or the right person for you. And so that may take some time. I do go over a little bit in that in my course on how to find, providers that jive with you and that you have a great relationship with, including pediatricians. It's the same advice with your pediatrician, finding someone that will listen to you and something's wrong with your baby. And so all of these things and having a team around you that like, and trust is also really important for reducing birth trauma.
That's awesome. That makes sense. So, what should a new mom do if she thinks she's experienced birth trauma?
So the first thing is, I always tell moms to journal after their labor and delivery experience,
Mm.
like right away. Write everything down, write all the feelings that you had, write every phrase that you remember being said, write it down chronologically. What did your partner do and say, how you felt about it? Try, get a sense for your feeling while you're journaling this, because sometimes a journal entry, a really emotional journal, right? It's amazing how much we forget, even 24 hours later, how things
Mhm.
and even especially a year later or whatever. So it's kind of neat to look back on that, whether it's positive or negative. And then taking that journal entry, if it isn't so positive, trying to like write it out, and then you can either ball it up and throw it away. And it could be cathartic for you to be like, well, all right, that's how it went. I journaled about it. I've kind of like woosah'd all my feelings off about it. And I'm just going to ball that up and throw it over here. And now I'm going to rewrite all the positive things about my day, and my baby is actually okay, even though we had to have a forceps delivery and he has a bruised face. He's beautiful, and he's already breastfeeding, and then just start to rewrite and try to change that. Use affirmation phrases or affirmation cards to try to keep yourself positive. It's really big on, how we talk to ourselves inside our heads. So definitely do that. Now, those are things that you can do for yourself if you think you're experiencing birth trauma, but there's also external help that you can get. And the first person to talk to possibly is your OB, who may be able to give you more information. I have many women who feel like they had such a traumatic birth that things just went horribly. And then they feel very guilty. Like I have NICU, because I do NICU. So I have babies who come into the NICU and they're sick, and their moms come and sit at the bedside and they cry because they think they did something wrong that hurt their baby. And nobody explained to them exactly what happened. They don't understand anatomically, why their baby's so sick. And I sit with them and I say, why do you think that you're the one who hurt your baby? Well, I should have come in sooner, or I should have done this, or I should have done that. And sometimes they don't even realize that there was a knot in the cord, and that's why their baby is so sick. And they didn't even realize that that was nothing that they did wrong. It was totally random. There was nothing they could have done to prevent it. Babies tie themselves into knots in the cords, and sometimes they're just fine, and sometimes they're born very sick. And that's just the way things happen sometimes. And there's no reason that you should have any guilt about that. But in their minds, they thought that they've done something wrong. And so I think it's really important to talk to your providers. So find out from your OB exactly what happened, because sometimes we have this misconception over what happened in that labor and delivery and what the cause was of something, I say going wrong, but like there are always things that don't go to, the way we want it to go. And so really understand anatomically and medically what happened, so that you can, feel, release some of that mom guilt for yourself. And then if it becomes more trauma for you down the line, you're unable to sleep. Some people, if their birth trauma can give them nightmares and other things like that, then you would definitely want to seek help from a professional. And so that would be a therapist, a psychiatrist, and things like that to work through some of those feelings. I definitely think therapy is a big one, even more than psychiatry. Psychiatrists will give you medication, which you may need, but definitely therapy is probably one of the better things to work through PTSD and birth trauma.
Oh, wow. So, your program is called Mastering Motherhood. And one of your goals is to help pregnant women transition into motherhood gracefully. And you find that it's best for women to learn about postpartum depression and anxiety before the baby's born so that they can best recognize it when it happens. So how are you doing this in your program?
Yeah, so I'll definitely answer that. And to preempt it, I always tell a little story about myself. So I have three little boys, and after the birth of my second son, Xander, I suffered from postpartum depression. But here's the interesting thing. I am a family nurse practitioner, and I have actually been trained to recognize and diagnose postpartum depression, symptoms of depression, also treat them. I'm legally, able to treat these types of things, diagnose them in patients. Yet I didn't even recognize that I had postpartum depression for
Mm.
months in myself. And it took a couple of months for me to realize it. I realized it finally after I noticed that I had the symptom of anhedonia, which is basically loss of joy in doing things that once brought you joy. So, for example, something I always loved to do, I just stopped doing, and I didn't understand why. And I didn't understand why that thing was not bringing me joy anymore. That was my red flag. But up until that point, I had had many, many other symptoms of postpartum depression, but I kept normalizing them in my head. This is normal for a mom of two children. I'm just sleep deprived. I'm up breastfeeding all night. It's a phase. I kept having every excuse in the book why this is totally normal, or I'll get over it on my own. I really did not want to put the label on it that it was postpartum depression for many reasons. I guess I just didn't want my husband to be worried, not to want to leave me with the baby if he thought I was depressed. That was a big one for me. I didn't want, to be on a medication. I don't really like to take medication. So there's a whole laundry list of reasons why I allowed my subconscious to kind of tuck that away and not let myself realize it. I was very lucky in that I had a very supportive husband that really supported me going through treatment and getting the help that I needed. I think that was a big key in me getting better so quickly. But after going through this experience, I also suffered from antepartum post-traumatic stress disorder. When I was I contracted COVID in March of 2020 as a 32-week pregnant woman with my third child. I caught it in the hospital, and I became so sick that I actually had to be hospitalized in my own hospital that I work in. And I was actually the very first hospitalized COVID patient in my entire hospital system. So my colleagues that I work with actually had to experiment protocols, COVID treatment protocols on me this was before we even had COVID treatment protocols. They were not
Mhm.
sure how to treat pregnant women, what was safe for pregnant women. And so here I was as a patient, hardly able to breathe with COVID, pregnant, and my own friends on my unit were trying things on me and trying to help me get better.
Mhm.
It was nerve-wracking for them. It was nerve-wracking for me, and it was really, really upsetting. And of course, we know a lot more now as far as risk to the baby, but back then we didn't know if my baby was going to be okay. Would he get COVID? What would happen? And so the going through that experience was so incredibly
Mhm.
stressful that I came out in the end of that with a really strong bout of PTSD, which made it very difficult for me to return back to work. And I am the type of person who can't wait to get
Mhm.
back to work. I love what I do, and it really impacted my, love for my profession. After that, I was scared to go back, and I had this like all these some anger. I had anger feelings afterwards. I was able to get help for that and work through it. But these mental health experiences that I went through after my birth really opened my eyes to what women feel and how difficult it must be for non-medical people to recognize symptoms. If it was difficult for me to recognize and come to terms with it and ask for help, I can't imagine how difficult it is for women who don't know what the signs and symptoms are and don't know how to get help. So I figured, I really need to help women ahead of time to learn what these things look like. They shouldn't be learning about it when they're going through it. When you're
Mhm.
feeling postpartum depression, that is not the time for you to start figuring out what you could do to help yourself, because all you want to do is sleep, or all you want to do is not everything else, and we don't have the patience and time, and we're feeding a baby and we're very sleep deprived. So that's really not the time to try to figure this out for ourselves. I really think it's better off done ahead of time. So we do a postpartum mental health plan. So all of my pregnant women that I'm working with, we come up with a plan for ourselves if and when we should suffer from any type of postpartum mental illness. That could be anxiety, depression, PTSD from a birth trauma, anything like that. And in the plan, we come up with providers, an actual name of providers that we would go see. And in some of my clients, I suggest that they make appointments. So if you have a high risk for some of these things, for example, if you suffer from anxiety before you've ever been pregnant, or you have a history of just having generalized depression in the past, your risk for postpartum mental illness is higher. And so those clients, I usually tell them to make an appointment with a psychiatrist and with a therapist for about a month postpartum, so that when you get to that month after you have your baby, if you're not feeling 100%, go to that appointment. And if you're feeling great, you can always cancel it. But in today's world, especially in the US, sometimes it could take us 3 months to get in to see a therapist, especially if you're a new patient. And women who are going through postpartum depression and mental illness don't have 3 months to wait. That was one of the struggles that I went through when I needed help, and I reached out and it was like, yeah, we can't see you for 2 months. I'm like, 2 months? I really want to come tomorrow. What do you mean 2 months? So I feel like we're lacking in our help as a society for women going through this. And so guess what? We need to help ourselves as women. So we need to take a active approach, a preparatory approach to this rather than reacting when it happens to us. And so I prepare them by making this plan. We come up with providers. We also come up with sometimes we choose medications that may work for us. We talk about medications that are safe in breastfeeding, so that they can have an idea of what they want to talk to their providers about if they need to go on medication. But we also really focus on non-medicinal treatments of postpartum mental illness. So that would be things like aromatherapy, acupuncture. I use acupuncture a lot for postpartum depression. It was really, really wonderful. I use it for many things. We talk about using music therapy, and meditation. All of these things can help us, uplift us, bring us out of our funks while we're waiting for these appointments to happen. We can at least get started with these things. So a lot of women who are going through postpartum depression make that appointment for 2 months ahead, and then they go, oh no. And instead of, reacting and doing something for themselves, they just get more and more depressed over that 2 months, to the point where it's harder to get better when they finally get to those providers. So don't do that. If you're starting to feel you got that appointment out ahead of you, you have to wait a little bit for it. Start doing guided meditation every morning for 10 minutes. And in my course, I have them download guided meditation, so they don't have to start searching for it. It's literally there. It's in their plan. They just start implementing their plan when things happen. And so it just makes it easier for them to get better, and to get better quicker, rather than months and months of trying to get better and just not feeling like yourself. Because I struggle with that a little bit. It took me time. It took me time to figure it out. And I thought, I don't want other women to have to take this time. I want to reduce that time. I want to prepare them better, and to, help them feel better quicker, so they don't have to, go 6 months and not feel like themselves. Maybe let's get better in 2 months. Let's get better in 3 months. Anytime we can cut down from that, the better. And if any of you have ever suffered with mental disorder, know that feeling that, those 6 months while you're trying to wait to get better, it feels like 2 years.
Yeah.
So if we can get better quicker, and any small thing we can do for ourselves, we should. So that is how I try to prevent. I try to prevent postpartum depression and anxiety by doing teaching and helping women feel more confident. But there are times that you can't prevent it. There's hormones, there's chemistry, and there's a lot of different factors involved. And so for some, it will happen. 1 in every 8 pregnant women will suffer from postpartum depression. So for some women, it will happen. And for those women, I want you to have all the tools that you need in order to help yourself, because it's really up to us. So
Yeah, that's brilliant. I was about to ask how common postpartum depression was. So,
yeah, 1 in every 8. If you know 8
wow.
who have had a baby or are pregnant, out of those 8 women, there's a high, pretty much one of them suffered from postpartum depression. So it's a very more common diagnosis than people realize. And we all know 8 moms
Yeah.
or 8 pregnant women. And you may not know, but one of them had postpartum depression. And that's the other thing is, we internalize it and we hide it and we don't tell people about it. So when people are going through it, it's an incredibly lonely diagnosis. We're already lonely as it is as new moms, because typically we're usually home with the babies by ourselves. And that is another reason why it's really great to find your mom tribe or your community, so you can get out and see other adults and have conversation and not be home alone all the time. But very much so, it can be a very lonely diagnosis. But yes, 1 in every 8 pregnant women will suffer from postpartum depression. So it's really, really common. And it's,
Yeah.
we don't treat it well enough. We don't teach women to recognize it. We talk about it. You hear people talking about it sometimes, but we don't really teach women to know what it looks like, what it feels like, and what they should do if they have it. And then, of course, the difference between the postpartum blues and the postpartum depression and postpartum psychosis. There are like 3 levels of postpartum depression, from mild to severe. So it's really important for women to know the differences to those, because one of them will just go away on its own without you doing anything. That's the postpartum blues. Many women have it. Almost all women have that. Postpartum blues comes and goes really quickly. You have these like mood swings and these crazy things where you're just crying out of frustration and but then the next hour you're okay and you don't feel depressed anymore. And it's just like these hormonal ups and downs that you're going through. That's usually postpartum blues, and usually in a month that resolves. You get into your mom groove and those go away. If those continue beyond a month to 2 months, usually that moves into postpartum depression. So if you're still having those mood swings, but usually they're less mood swings and it's more that you feel some of these symptoms all the time. They're not short-lived anymore. They're going on for longer bouts of time. And then that, is usually postpartum depression. And then further on, it's postpartum psychosis, which is really, really rare, but it can happen. And that is when women are having hallucinations and things
Oh,
that
wow.
there, and that is when women do things to hurt their children. It's just that they are having hallucinations and they don't know what's reality. And
Mm.
that is an emergency. So that would mean if someone thinks a woman is going through that, they need to not leave them with their babies. They need to take those women to the emergency room right away. But
Wow.
that's extremely incredibly rare. But many times when people hear about postpartum depression, they think of postpartum psychosis and they put the two
Mm.
together, but they're not the same thing. And so sometimes, people will put them in the same category and treat postpartum depression like they're psychotic or like trust them to be with their babies. And so that can be stressful for women going through postpartum depression who don't have hallucinations and aren't planning on hurting themselves or their baby. But that can be very confusing for some people and to differentiate, important to differentiate for everyone. And this is also something partners need to learn about. So part of my course is that we don't just, it's called Mastering Motherhood, but there is a huge partner element to my course because you really coming into this as a team. And you need to know how to support one another and communicate with one another in order to make this journey a little bit easier on both of you.
Yeah, so what are some of the do's and don'ts that for a partner who wants to help a mother who's suffering from some kind of postpartum mental illness?
Sure. So there are some, ideas of things that they can do, but generally it is a conversation that the partner needs to have with the mother ahead of time because every person is going to feel differently and react differently to certain actions and certain words. So really you need to have a conversation with the pregnant woman ahead of time. So you say, hun, if I really feel like you're having any signs of depression or I think you're struggling, how would you like me to help you? How would you
Mm.
like me to communicate to you that I'm worried? What would you like me to do, say, things like that? Because some women may want you to be completely direct and come to them and say, I think you need help. And other women might say, that would probably set me off and I'd probably be really upset if you did that. How about we come at it this way? And instead of telling me you think I'm depressed, you can tell me, hey, would you like me to take over all the dish duty for the week? Something like that. So it can be actions. Typically, it helps when your partner many times new moms end up being the default parent. So a default
Mhm.
parent is basically the person who takes care of the children or child and the household. When household meaning bills, laundry, grocery shopping, cooking, and it becomes a lot. And so many times, it's helpful if the partner takes on some of the default parenting responsibilities. Again, this also needs to come with a really great conversation. And prenatally, the conversation should come about who's going to do the default parenting chores and
Mm.
tasks. That nobody really discusses that ahead of time. It just ends up sometimes turning into the mother's role. And so without ever having a conversation about that, moms can resent that when it's going on for them.
Mm.
So it's really good to have verbal communication like, hey, after the baby's born, I'm going to really be breastfeeding for 12 hours a day. Because if you're exclusively breastfeeding, you're breastfeeding for about 12 hours a day. You're working
Wow.
more than full-time job, 12 hours a day, 7 days a week to breastfeed a baby. And that doesn't count the time that you need to eat and drink to nourish yourself and for that baby. And that doesn't count the time for cleaning pumping parts if you're also pumping. Okay, so if you're pumping as well and feeding express breast milk, you have to add time on for the pumping and add time on for washing pump parts. And it
Mm.
is an incredible amount of time that we're spending just feeding the baby. I think teaching partners that information to tell them that it's such a commitment to feed a baby. And this is breastfeeding, but also bottle feeding baby takes a lot of time. You're doing it so much for so long. However, a partner can sometimes split those responsibilities, right? So this is all great to have a conversation ahead of time on what our jobs are going to be. You could say to your partner, I'm going to be breastfeeding my baby for 12 hours a day, and I'd be happy to take over laundry duty. But I think for the first month of the baby's life, it would be really great if you do the laundry or we have a laundry service. Now, that is so much better having that conversation ahead of time rather than 2 weeks postpartum when the laundry is building up and nobody has underwear and everybody's panicked about it. And then everyone's yelling about it and no laundry is getting done and we're fighting over it. It's so much better to have a plan in place on what we're going to do to make sure that everybody's happy. So if your partner doesn't want to do the laundry, then fine. You're going to drop it off and pick it up and take it to a laundry service if that's within your budget. Or, you're just going to maybe have your mom, if you have other support systems. So you have to identify who your support system is. And that might be something you can ask a friend or a mom to do, just to take it off you for a little bit. So that is how a partner can help support a woman if she's going through some sort of postpartum depression or trauma. But even if she's not, just coming into a transitional role as a mother is difficult enough. And it's really important to have these conversations, I think, ahead of time. So, really it's preparing for it in case it's going to happen. And then the other thing is, if a mother is really going through postpartum depression and she needs help and she comes to you and says that, as a partner, it's really important for you to just tell her it's going to be okay. You're going to work at it together as a team. And you are going to figure out how she's going to get help. So, she needs to make an appointment with somebody, but you have to think many times women don't go to these appointments because now they need childcare for their appointment. Okay? So that was one of the good things that came out of the pandemic, is how easy it is to get virtual appointments now with mental health providers, if you can find one, of course. But it's easier for a mom to do a virtual appointment with her baby in her lap than it is for her to find childcare for her baby so she can go to the office and have the appointment. Some, therapists will allow you to bring the baby with you, although it is a little bit more difficult, to have the baby there the whole time because you're focused on the baby and not on your therapy. So it does help to have, help with that. So, that's what your partner can do, is say, let's get you some help. And we're also going to set up some babysitting, or we'll have some people from our church, help watch the baby, or grandma or auntie is going to help watch the baby. And we're going to set something up and, take it, because as moms, it's so hard for us to give that over. We don't want to ask for help. So it's helpful sometimes for our partners to just sort of, take that on. Don't worry. You call and find the provider. I'm going to find the childcare. And, we're going to go buy a bunch of paper plates so we don't have to wash dishes at all this week, and we don't have to worry about that. And so that is the things that they can do, is try to take off worries of being the default parent, because that can really compound when we're having a tough time as a depressed new mom, and then get help from other people around us. And then, of course, meals. Anytime you have anybody coming to visit and see the baby, they should be bringing a meal. They should bring Dunkin' Donuts and Starbucks, or they should be bringing meatballs and spaghetti. And, that is really what we're also lacking as new moms, is the proper nutrition. So they don't have the time to cook. And so always tell your visitors or your friends and family who want to come see, sure, come, but bring me this, and, that way we can all have a meal together and I can eat a healthy meal and you can come meet the baby. But many times we don't ask that. We don't want to ask that of people. Instead, we run around crazy trying to clean the house before they come over. And now we're extra. So instead of taking the nap we should have taken, we did that. And really we should just communicate. I would love for you to come meet the baby, but I don't have the dishes done. Maybe you could help me with that. A lot of people would be happy to help with it. Some just don't think to ask. And so it's okay as a new mom to ask for that. So those are things that you could do to try to help yourself through some of those harder times and have your partner help you.
That's awesome. I wish I had kind of had all of this information. I had postpartum depression. My pregnancy was weird because I was adopted. So I always had a huge fear of having someone who was biologically related to me, because I didn't know anybody I was biologically related to. So I was scared about just what kind of a different kind of love that would be. But then I got pregnant and I loved being pregnant. It was weird, this little alien creature inside of me, doing all these weird things, but it was just so fun. I really enjoyed it. And then, I had my baby, and I had to have a C-section because I had 2 episodes of a collapsed lung during my pregnancy. So my OB-GYN was worried about that, but, my kid was really resilient. She was great. They had all these, straps on me and these monitors all the time when I was in the hospital, and she was just great. She was just in there chilling out and dancing and whatever. But yeah, I was just devastated that I wasn't pregnant anymore. And then, 3 months into breastfeeding, which was this wonderful bonding time with my baby that I just cherished and loved, she stopped breastfeeding because she was having these chronic ear infections, and it caused her pain to lie in that position. And that devastated me as well. It's like I really just felt like I lost all this special time, with my this bonding time with my baby. But
That is very, that can be really upsetting when that happens. I definitely know that feeling. So I just finished breastfeeding my third. Well, I say
oh.
breast, but it was a lot longer than that. He probably finished a year, and he's 2 now. It feels like it was just yesterday. But I remember crying because not only was it our time to finish, but it was my all around because he's our last baby. So
Mhm.
after the other 2, I was sad when our journeys ended, but I kind of also knew we were going to have other kids. So it was going to start all over again and things were going to be okay. And then after this third finish, the emotional,
Mhm.
the wave hit me so much stronger than it did for the other 2, because while it was our end of the journey, it was also at the same time my end of breastfeeding forever. And I still have breast milk saved in the freezer. My husband keeps saying, "Why do we have this in here?" I'm like, "I just can't throw it out."
Yeah.
But yes, we have to, hold space for ourselves to feel those feelings. Everyone's going to have different emotions. Some people hate being pregnant. Some people love
Yeah.
being pregnant. And you never know how you're going to feel about something until you're going through it. And I think that's why it's really important to, like I said, journal. Journaling is a great way to work through some of those feelings and just get a comfy spot and a really great pen and just start writing feverishly, even if you can't read your own writing, and just throw it out there on paper, and work through those feelings. And you'd be shocked to how as you're journaling, it starts off, oh, very negative. I'm so sad. I want to breathe breastfeeding. But if you keep writing, keep pushing through, you'd be surprised how your mind can almost turn it around. And by the time you're finished
Mhm.
writing that couple of pages of journaling, you might have hopefully turned it around into something positive or into the next step that you're going to be, or the next phase that you're moving into, whatever that might be. And if you're not able to turn it into something that feels a little bit better, then it's really great to get a therapist, and start talking to the therapist about working through those feelings. But I definitely think that that's always a worthy plan. So.
No, that's great. So your Mastering Motherhood program sounds really great. Where can listeners find more information about you and about your program?
So I have a website, www.newmommyguru.com, where you
Mhm.
connect with me. You can make an appointment to have a chat with me, and we can see if my course is right for you. Of course, I want to help as many women as I can, but if what you're struggling with isn't something that I can help you with, I want to refer you to something in the right direction. So I usually encourage clients to come and have a chat with me. We can have a 30-minute call about what you're anxious about, what your history has been, and see if this course is going to be beneficial for you. And if so, then we move forward with it. If not, I'll refer you to somebody that I think can help. And on the website, there's links to all my socials. I'm on Instagram, Facebook, LinkedIn, all as New Mommy Guru. You can find me on any social media with that handle. And I also have a great little a link tree that has some great links in it for Amazon wish lists. So I have lists in there for the best breastfeeding products that I think work well for breastfeeding. I have a list for hospital go bag, things that I think you should bring with you to the hospital. I have a list for lactation cookies and how you would make those. And so this link tree has some wonderful resources on there for people. And I will share that with you, Lauren, so you can post it wherever you're posting this podcast and people can have access to that. So, but
Okay.
definitely connect with me if this resonates with you. If you're pregnant, you're thinking about having babies, or you're trying to conceive, we call that TTC. If you're TTC or currently pregnant, reach out to me. Let's have a chat and have a conversation and see if my course will be right for you. So, yeah.
Awesome. Well, thank you so much for coming on.
Thank you, Lauren. This was so lovely. It was so nice getting to know you, and I appreciate you giving me an opportunity to help any of your listeners out there today. So good luck to
Yes.
you. Thank you for all you're doing. I think this is wonderful, the podcast that you have here to help women. So thank you.
Thank you. And listeners, you can find me at ithurtstomom.com and at ithurtstomom on Instagram and Facebook. I'd also love to hear from you via email at ithurtstomom@gmail.com. Hope everybody has a wonderful and blessed day. Bye.